Our guest today is dealing with colon cancer, which is one of the most common forms of cancer in both men and women. Talk about what it is, why it's so common, if we know, and how it's generally dealt with.
Well, this is a great worry, colon cancer. What I worry about for many reasons, and we won't go into that today, but why are we getting not only more colon cancer, but in younger people? And as I shared in many other occasions, that I've now seen it, and we have colleagues who are seeing it in patients who are 10-year-old, 11-year-old, 12-year-olds. That is like impossible to conceive. I have some theories of why that goes on, but let's just talk about colon cancer per se. There's really, in a funny way, two types of colon cancer. One in which the immune system can really see it very easily, and that's called microsatellite instable, meaning the cancer hasn't hidden, so your immune system can go after it. And then there's a type of colon cancer where your immune system can find it. And what's scary is over 80% to 90% of colon cancers are those types of cancer called microsatellite stable. That's a technical term. So what we have today is a challenge to identify it early, to identify it even before it happens. So this is where we have now Lynch syndrome patients. 1 in 280 Americans have this genetic issue that you actually have polyps in your colon that are waiting to become colon cancer, and 80% higher incidence of colon cancer. So on the one hand, you can maybe, and this is where we are now in trials, very exciting to prevent that from happening. On the other hand, we need to detect it early, and there's tests, the CEA tests, and there's where you can look for blood in the stool. But most importantly, we need to go after that 80% of colon cancers from which a tumor hides, called microsatellite stable. Remarkably, all the drugs that we have today in the United States, the checkpoint inhibitors, go after this 15%, not
Right.
other. So the opportunity for us now to address this, and we may have multiple series on colon cancer in our Cancer Decoded talks, Mark. But today you'll hear from a patient that has, I think, beat this disease.
Yeah.